Hello and welcome. I'm Dr. Gregory Rokosz, Chief Medical Officer at Hackensack, Meridian, Old Bridge, and Raritan Bay Medical Centers. It is my honor today to moderate a panel discussion about advances in thoracic surgery and how these advances are benefiting patients. We will also be conveying important information about certain health risks. Our guest experts are Drs. Faiz Bhora, Dr. Kostantinos Poulikidis, and Dr. Mohammed Latif. Dr. Bhora is a professor of surgery, regional chair of surgery, and chief of thoracic surgery for Hackensack Meridian Health's Central Region. Dr. Bhora specializes in advanced robotic techniques used to perform minimally invasive operations for lung cancer, esophageal cancer, mediastinal tumors, in addition to all other surgical conditions within the chest. He is a nationally and internationally recognized for his expertise in robotic and airway surgery. Next is Dr. Poulikidis, a thoracic surgeon specializing in surgeries of the lung, airways, chest wall, diaphragm, esophagus, and lungs. He is also a member of the Division of Thoracic Surgery. His training focused on robotic surgery of the lung, esophagus, mediastinum, and included completion of the American Association of Thoracic Surgery Advanced Robotics Fellowship. Finally, we have Dr. Latif, Regional Chief of Esophageal and Site Chief of Thoracic Surgery. Dr. Latif diagnoses and treats patients with both cancerous and non-cancerous disorders of the chest, including those affecting the lungs, esophagus, mediastinum, and diaphragm. Dr. Latif's training in cardiothoracic surgery focused on the complex management of benign and malignant diseases of the esophagus. In addition, he completed advanced fellowship training in thoracic surgery, oncology, and robotic surgery. Dr. Bhora, can you explain to our viewers what exactly is thoracic surgery and what kind of conditions do your surgeons see?
Thank you so much. Really excited to be here and introduce my fellow surgeons as well. Thoracic surgery, Greg, it's a specialty that involves operations within the chest cavity. That's how I like to explain this. It's a little bit hard to say thoracic all the time, so I think chest surgery is perhaps a more apt description of this. And in essence, we're surgeons who deal with all disorders that happen within the chest cavity, which includes the trachea or the windpipe, the lungs, and all the structures around the heart. So the diaphragm, the mediastinum, or the space that is around the heart, as well as structures of the chest wall and the space that's in the chest but outside the lungs, so the thoracic cavity. I will also add that we also take care of disorders of the esophagus or the eating pipe. And so in essence, it's everything in the chest from the neck down to the belly button and all the structures that are included within it.
Dr. Poulikidis, what are the examples of some of the most important advancements in thoracic surgery, and what are those most significant ways in which thoracic surgery and these advances benefit patients?
Thank you. There's actually been many advances over the years in thoracic surgery, specifically in terms of how we do surgery. Historically, it was done with very large incisions, long hospital stays, but fast forward to today, surgery is done with very small incisions with the robot, and I foresee in the future technology is going to be where it can be applied to certain cases with just one small incision. This is great for patients because it's much better for their pain. They're out of bed, walking right after surgery, and most of the time they're home the very next day. Other advances is going to be just with lung cancer, for example. We're able to identify cancers, even more advanced cancers that historically weren't surgically treated, can now actually get treatment and become surgical patients. So patients are with more advanced cancers are being treated with surgery.
Are there more options for treatment or additional procedures, such as procedures to preserve as much healthy tissue as possible? And why might that be better for patient outcome?
Absolutely. Surgery of the lung, it doesn't just involve removing the tumor itself. It'll involve removing a large portion of the lung. But with time and advancements in thoracic surgery, we're able to resect the smallest possible amount of lung that's needed to be removed. That's great for patients because you're you're preserving lung. It's going to be much better for their shortness of breath, especially patients who may not have the best lung, because we are talking about smokers. So you're taking a lot less lung. It's much better in terms of their symptoms. And God forbid another cancer can pop up in the future. You've taken minimal lung, you can still treat them again.
Dr. Latif, to illustrate how much we've progressed in thoracic surgery, can you give us an example or two of what thoracic surgery outcomes and recovery looked like perhaps a decade or more ago, and what's possible today?
Thank you, Greg. Thank you for having me on the panel today, and that's a very good question. Most people don't realize how far we have come along in the treatment of thoracic malignancies, specifically the most common cancer, which is lung cancer. And I'm talking not only about the surgical options, but also the medical treatment for these patients. I'll give you an example. Up until 5 or 6 years ago, a lung lobectomy, which is a standard operation for lung cancer, the patient would be in the hospital for about 5 to 7 days. And with robotic surgery, the national average is about 3 days or so. I will say that within our hands and our program with an excellent team that we have developed here, our length of stay is 2 standard deviations below the national average. So most of our patients go home the next day or in a day and a half.
2 standard deviations below is a really good thing.
Yes, of course.
Mm-hmm. Dr. Bhora, what differentiates our program from others in the region?
So I love getting this question, Dr. Rokosz, because it's near and dear to my heart. I moved to Hackensack a couple of years ago from New York City. The goal really was to build a world-class program here in our central region, particularly based out of Hackensack Meridian Old Bridge Medical Center. And we have a truly world-class multidisciplinary team who gets involved in our patients from the outset. So if you've been diagnosed with a lung nodule, if you've been diagnosed with a lesion of the esophagus, we bring to bear an entire team right at the outset that will navigate your care, that will guide your care from diagnosis to staging to the best initial therapy. And I think this is very important. Where you get your care and what care you get at the outset is a very important factor in your long-term results. And I think the team that we have put together here at Hackensack is second to none, from the surgeons to the medical oncologists to the interventional pulmonologists, all the other specialties that come to work cohesively in patients who have a tumor of their chest. I think the other thing that I'd like to highlight is that we have the most advanced technology that is available, not just to diagnose your cancer at the earliest possible stage. For instance, we have the most advanced robotic bronchoscope in the state of New Jersey within our program. And that allows us to find your tumor in the earliest possible stage when it is most curable. And then, as has been said, to bring to bear the most advanced robotic surgical techniques to remove the tumor completely and put you on the path to cure. In addition, we look at the patient holistically. It's not just surgery sometimes, it's the addition of targeted therapy, immunotherapy that is all combined right at the outset in your care, such that you truly get the best outcomes.
Great, thank you. Being faced with a possible cancer diagnosis is frightening. Your team actually gets involved prior to a definitive diagnosis. Can you take us through the steps and the process of why and how a patient may be referred to your team and what those steps are?
A lot of times patients will get diagnosed with a nodule in their lung. This could be either by their primary care, pulmonologist, oncologist. At the end of the day, they need to know what exactly this nodule is. So we'll get involved when it comes time to get a diagnosis, get tissue. And there have also been advances in how we go about doing this. We have a robotic bronchoscope, a robot that we control, the camera that goes down through the windpipe to the nodule itself, where we can get tissue to not only tell us, one, is it a cancer, two, what kind of cancer it is, but even further, run further tests to know what the best treatment can be in terms of chemotherapies, immunotherapies, targeted therapies, either before or after surgery.
Yeah, I think the most frightening part, Greg, for the patient is the uncertainty that comes with the diagnosis. As Dr. Poulikidis alluded to, I mean, as thoracic surgical oncologists, our job is to make sure that the patient understand those options are both for diagnosis as well as treatment, surgical, non-surgical, and then let them be in the driving seat for making that decision of the treatment. So we truly believe that the patient needs to understand and make their decision for the treatment.
I just want to add that in addition to the initial treatment, we have a program here where we're able to bank patients' tissue, the cancer and blood, such that if there are any new treatments that become available or a clinical trial is available, then very quickly we're able to deploy these new treatments in your particular treatment, and hence providing the most personalized and agile care for your particular tumors.
What are some of the most common conditions that you're seeing, and how might that have changed from several years ago?
With the advent of screening, and I think this is a really good segue, I think if there's one message that I want to impart to our audience who are listening today is that if you are a smoker or if you are exposed to significant smoking, then I would very strongly encourage you to reach out to your primary care physician or your pulmonologist. Make sure you get a lung cancer screening study. That is the most life-saving thing that you can do for yourself or for your loved one. So that's number one. I think having said that, because of lung cancer screening, we are seeing patients with earlier stage cancers, much more treatable cancers, which is a good thing. We're also beginning to see cancers in never smokers and particularly women. So I would encourage folks who, if you have a cough that's been a little persistent and is nagging, is not going away, then I would encourage you to certainly see your medical provider as soon as possible to get checked out.
I would also like to add, for esophageal cancer, the guidelines are not as clear-cut as the more common cancers, which are lung and colorectal. I do tell, but it is a deadly cancer, and unfortunately, a lot of times diagnosed at an advanced stage when the symptoms occur. So I do tell patients to have an endoscopy done if they're going for colonoscopy for colorectal screening after age 45 and onwards. I think especially if they are smokers, they have heavy alcohol use, or if they have family history, for those patients it's important to have endoscopic screening for esophageal cancer done as well at the same time.
Yeah, and aside from lung cancer, esophageal cancer, we're also seeing quite a few patients for, masses in the center of the chest, the mediastinum. We're doing quite a bit of diaphragm work. So patients that have chronic shortness of breath where their diaphragm's elevated, we can go in there robotically and repair that, get their breathing back to what it used to be. Of course, also the chest wall, we're able to resect lesions that would normally take big incisions with very small incisions now. So we're seeing quite a few more patients.
And I think one other excellent program, which truly state-of-the-art, is our minimally invasive lung volume reduction surgery program. So patients with advanced emphysema or COPD on oxygen, can't breathe, can't perform activities of daily living. We have perhaps the largest program with the best outcomes, where we bronchoscopically or endoscopically place small valves in certain areas of the lung to help decompress it, such that the more normal areas of the lung can function better. And this, in selected patients, leads to a dramatic improvement in breathing. That feeling of suffocation that patients have with advanced COPD, in a significant majority of patients, can be ameliorated. So just wanted to make sure that our audience knows about our endobronchial valve program, the Zephyr valve program for patients with COPD.
Dr. Latif, is there any special approach to patients who may have precancerous conditions of the esophagus?
We do have an advanced GI program, so we collaborate with our gastroenterology colleagues. Patients who are high risk or have known Barrett's esophagus, which is a precancerous condition, follow them longitudinally with repeat endoscopic screenings and help diagnose esophageal cancer at an early stage.
Are your patients that you're seeing now younger than they used to be, or more predominant one gender or the other?
That's our kind of observation now. I'll tell you that I recently operated on a patient who's 30 years old with esophageal cancer. I think with advancements in screening, imaging, and endoscopic therapies, I think more and more we are finding patients at a younger age and at a stage where their disease is still curable.
Dr. Bhora, if someone needs to make an appointment to see a member of your team, how soon can they get in?
I think we pride ourselves on access. Do not want to be the world's best kept secret. And so my promise is that in most cases, we're able to see you at times, perhaps even the next day. One of the surgeons and other members of our team are available. And but I would say certainly within 48 hours, the expectation is that you will be face to face with an expert in your condition. I also want to highlight that we truly believe in a multidisciplinary approach. We believe in teamwork, and I think that's what really sets us apart from other practices and providers. So it's access and teamwork.
You have such an amazing team, and that's amazing and great. So I'd like to thank you, Doctors Bhora, Poulikidis, and Latif, for sharing your expertise and insights with us today. You've provided very important information and guidance to our audience. For our viewers, if you would like more information about the surgical services discussed here today at Old Bridge Medical Center, or you wish to schedule an appointment with our doctors here, you can call 732-635-9300. Thank you.